It's 11 p.m. and you're frantically waiting nervously as your 1-year-old has a temperature of 105. The ER is full of fellow worriers, all just waiting for the next name to be called. Busy and apologetic, the staff tries to accommodate to everybody's needs. Finally, a nurse actually comes out and asks you to be able to follow her. You go into the next room where you wait more. The doctor enters, just relieves every worry that you have. Your kid is fine. There are very many similar stories that all of us have that regard this. The waiting, the worrying is over, but the constant doctor waiting will always happen. Health Affairs did a recent survey that showed that the U.S. faces a physician shortage, and this impending physician shortage cannot be overcome by just supplying more physicians. Today I want to be able to talk about what a physician assistant actually does and where you may encounter one. The idea of where it stemmed from. The idea originally stemmed from the medic-doctor association between each other during World War II. As the veterans actually came back, they had no place to be able to apply any of their skills that they had required. The medics quoted as, "Despite extensive training and experience, there is no civilian equivalent healthcare profession for these veterans, despite the program that they had reached." So the program of creating a PA was created to reach more people, to supply more demand, or to supply more for the demand. In 1974, civilians actually started being welcomed to the program as well. Physician Assistants Historical Society website cites Charles L. Hudson as being the first one to come up with this idea. He was a lieutenant colonel in the Army Medical Corps. In 1961, he proposed the idea to the AMA. The American Association of Physicians Assistants website cites Dr. Eugene Steed, a Duke Medical Center doctor, to create the first PA program. He did so in 1975, and the first class was actually just 4 Navy hospital corpsmen who have graduated 2 years later. In 1967, our Dr. Richard Smith, our local man here of Seattle, who also served, founded our local MedX, which supplies PAs for around here. He did a location in Seattle first. There is now one in Tacoma, Spokane, Anchorage, and also one in Montana. The PA purpose was to reach the neglected. Doctors were frustrated not being able to see all the community they actually wanted to see, but we still need an education for these people, and hence the education the PA programs came about. MedX, in association with UW, requires that you have 2,000 hours of experience in the medical field prior to even applying. You also need to be able to be part of your community as far as volunteering goes. You also need some degree of education prior to that, accounting for an AAS, a 2-year degree with general biology, microbiology, statistics, both AMP1 and AMP2, and 2 English requirements above the credits of 100. The BA overview is a 25-month training session, the first year being part of didactic, the second one being of clinical. The didactic years include more anatomy and physiology, clinical skills. They teach behavioral medicine, adult medicine, emergency medicine, technical skills, and more. The clinical year focuses out in the field, and they do follow for family medicine, behavioral medicine, emergency medicine, general surgery, and more. Following all of their training, doing at least 12 credits per quarter after this 2 years, they take a national certificate test where they have to pass that. And after they even pass that, to become a PA, you have to do more training if you want to be able to specialize from there. To stay a PA, you have to receive 100 hours of medical training every 2 years after that, and be retested every 10. The role of a PA in the medical field, they can do many things after the education. They can actually take medical histories, they can do physical exams, diagnose and treat illnesses, interpret tests, write prescriptions. PAs share responsibility, but always underneath the consultation of a physician. The National Commission of Certification of Physician Assistants cite that physician assistants works in many different areas. 20.5 work in family medicine, 19.1 work in surgical, 13.9 in emergency, and then the other are scattered between internal medicine, dermatology, pediatrics, just an array of different medicines actually through there. In conclusion, I'd just like to say that PAs were created to relieve a demand. They are highly educated and they are there to work for a healthier community, to reach more people that are out there. Doctors can specialize more timelier with more unusual cases. People are living longer, requiring more steps. More visits is creating a ratio of losing ground. They were the reason they created and it remains true today. Thank you.